Hello coder, welcome to Past Coder 21 Pre-Medical Coding YouTube channel. Today we are going to learn role of anticoagulant and antiplatelet drugs in medical coding. As all of us know, while coding any chat, most of the time we will use long-term use of anticoagulant and antiplatelet drugs. In this session, we are going to learn basically what is anticoagulant and what are the common anticoagulants, and also we are going to learn what is antiplatelet drugs and what are the most common platelet drugs we will see in our documentation. If you like this session, please click on like button to motivate us. If you are visiting for the first time, please click on subscribe button to receive future updates. So, what is the use of anticoagulants and antiplatelet drugs? So, basically, anticoagulants and antiplatelet drugs prevent the formation of blood clots, which can lead to dangerous health conditions such as stroke, deep vein thrombosis, and pulmonary embolism. So, basically, in order to prevent blood clots, which in turn create dangerous health conditions. So basically, in order to prevent blood clots and also prevent stroke, deep vein thrombosis, and pulmonary embolism, we will use anticoagulants and antiplatelet drugs. Anticoagulants are primarily used to prevent blood clots in patients with pre-existing conditions or a high risk of developing them. Common indications include atrial fibrillation, DVT, pulmonary embolism, and heart attack. So basically, these are the pre-existing conditions. If patient have pre-existing condition of atrial fibrillation, DVT, pulmonary embolism, heart attack, we need to code long-term use of anticoagulants and antiplatelet drugs based on the available documentation. So if the patient has atrial fibrillation, DVT, pulmonary embolism, heart attack, patient must and should have need to take these anticoagulants as well as antiplatelet drugs in order to prevent blood clots. Common name for anticoagulants and antiplatelet drugs is blood thinners. So basically, these are the blood thinners. We will promote free flow of blood in the arteries. So what is an anticoagulant drugs? So basically anticoagulants are medicines that increase the time it takes for blood to clot. So basically anticoagulant drugs will promote free flow of blood by preventing the clot. So anticoagulant means anti means opposite, coagulant means clot creation. So in order to prevent clot, we will use anticoagulants. So what is an antiplatelet drugs? So basically antiplatelet drugs are medicines that prevent blood clots. So basically the function of anticoagulants and antiplatelet drugs are same, but the thing is that they will act in a different way which we are going to learn down. So antiplatelet drugs work by stopping your platelets from sticking together. So antiplatelet drugs are used to avoid blood clots which can cause heart attacks and strokes. So basically antiplatelet drugs will promote sticking of platelets and also prevent blood clots which can cause heart attacks and strokes. So please mention in the comment section what are the common anticoagulant and antiplatelet drugs which you have used in while medical coding. So what is the difference between anticoagulant and antiplatelet drugs? So as we discussed before, their main function is prevention of blood clots, but the process of acting is different. So anticoagulants interfere with proteins in our blood that are involved with clotting. So anticoagulants only act with the protein which are involved in the blood clotting process. And in another way, antiplatelets are interfere with the process of platelets binding together. So basically antiplatelets will prevent binding of the platelets. So what are the types of anticoagulants? So basically there are two main categories of anticoagulants: direct thrombin inhibitors, factor XA inhibitor. What are the examples of the direct thrombin inhibitor? Dibigatran and agratroban. So what are the examples of factor XA inhibitors include? Rivaroxaban, apixaban, edoxaban. So usually we will use rivaroxaban while coding our medical coding records, which is the most common anticoagulant preferred by the physicians, and also apixaban. So if you see in the documentation apixaban or rivaroxaban, you need to think that patient have some type of chronic conditions like stroke, DVT, or pulmonary embolism, and we need to check the documentation in order to code long-term use of anticoagulant. So what are the types of antiplatelet drugs? The most commonly used antiplatelet drug is aspirin. So which is the most common medications we will see in our medical documentation while coding. Here, ADP receptor inhibitors makes platelet less sticky, like clopidogrel, ticagrelor, ticlopidine, parsugrel, which will prevent platelet sticking. Next, adenosine reuptake inhibitors, blood enzymes involved in clotting. Glycoprotein platelet inhibitors block substances that help clots stick together. So basically, we need to know the main difference between anticoagulants and antiplatelets, and most common antiplatelet drugs we will see in our medical coding documentation is aspirin as well as clopidogrel and also ticagrelor. So whenever you see these medications, you need to check for the conditions like pulmonary embolism, DVT, stroke, and heart attack. Who can't take anticoagulants? So patient with a history of bleeding disorders, active bleeding, or recent surgery should not take anticoagulant or antiplatelet medications, as are the main mode of anticoagulants is to prevent the blood clotting. If the patient is already having bleeding disorders, we can't use anticoagulant drugs. So among these, Eliquis is very common, Comedin common, Xarelto very common, and also Pradaxa. And what are the most common antiplatelet drugs? As we discussed previously, aspirin is the most common medication, and also Plavix and Agrinax. So Agrinax is also most common medication, and also we can check for Brillianta. Next, how do we call long-term use of anticoagulants and antiplatelet drugs? So as all of us know, in order to code long-term current use of anticoagulant, we will use Z79.01 and we will use Z79.02 for long-term current use of antiplatelets as well as Z79.82 for long-term current use of aspirin. So you need to understand that these all are blood thinners. They will prevent the blood clotting. Thank you guys. Thanks for watching Fast Coder 21. If you like this session, please click on subscribe button and also click on like button to motivate us and also share about our channel to your friends.